Well, we're very interested in your experience because, as I mentioned, you were the first doctor to suspect a different coronavirus strain. What did you notice in your patients?
So that's very interesting. For at least the last 8 to 10 weeks, we had what I call a breather, and we didn't see really any COVID-19 patients. Our infectivity rate was less than 1%. So around about this 18th, a young man came in, he's 30 years of age, said to me, he doesn't feel well, he's very tired, and he's got a slight headache and body aches and pains. And he actually thought as well that it was because he was working and it was extremely hot on the Saturday, and he thought that it was coming from that. But for me, to have that type of symptoms, I decided to test him, and he tested positive. Simultaneously, his family also made an appointment, his wife and one child. They said to me, no, they don't feel well, more or less the same, but not as tired as her husband. And both the mother and the child also tested positive, and there was a baby of 4 months old, and we tested the baby. Baby didn't have any symptoms, and the baby was fine. The baby tested positive as well, but not very, very mild disease, easily treatable. The man is already back at work, and thereafter we have seen 7 more patients on the same day. Very unusual, because I have access to the advisory committee. We normally chat on the WhatsApps, and I said, listen, guys, I've seen very interesting cases today. It's not the same clinical symptoms, and with the Delta variant, it's more similar to Beta. At that stage, I thought it was maybe more Beta related. The only other solution was, or conclusion was, that it should be a new variant. They said they're not aware of any variants at that stage, of variants that is affecting us. But at the same time, simultaneously, our labs also pick up a PCR test that was different from the normal PCR results that they set. And so everything sort of worked together. They also alert the NICD, and then last week, the new variant was announced.
Can I just jump in, Dr. Coetzee, because before we get to what the lab found? So it was a young man. So the symptoms you mentioned, they were mild, they were easily treatable, and they were different in that it was exhaustion, just a general malaise kind of feeling. So yes. These were, but yes. It's key that you notice mild and easily treatable. So off these samples go to the lab, and this new variant is identified with 32 different mutations. And when that information comes back to you, what then was your reaction?
Well, actually, I did a rapid test on that young man, and my reaction was one of shock. I didn't expect, after 10 weeks of peace, life coming back to normal. That was really a big, big shock. I think the poor patient saw the shock on my face, because I said, no, not again. I don't, it's like PTSD. You don't want to go through this again. You have been through that now 3 times. Are you going to go through this a 4th time? But unfortunately, there's nothing that you can do. You will go through it.
I think that's a bit what the world is doing, but we'll get to global reaction in just a second. So you had shock too, and now at this point, now that it's been identified with all of these mutations, such a high number of mutations, a variant of concern is identified so quickly by the WHO. What are the key, how worried are you about this, and what are the key aspects that are causing that level of concern for you?
So at this stage, at this moment in time, we are seeing young people mostly with who's been positive. So far, again, that is up until today. Maybe next week the picture will change. They are easily treatable at home. There's no need at this stage for anyone to be admitted, the ones that we are seeing, and the same with some of my colleagues. Also spoke with some of the specialists at some of the bigger hospitals in the Pretoria region, because we are the epicenter. Also didn't see a huge influx of patients coming in, 1 or 2 patients in the hospital. Not the same that they are seeing in the Baragwanath Hospital. They are seeing more young people. I'm not sure what amount of, or what is the number of people admitted there, but they have comorbidities. And whether that's Omicron or Delta, I'm not sure. What we are seeing in the surgeries, again, it's predominantly young people. And interesting enough, I have on Friday sent 2 patients for a PCR test. One 66-year-old lady has been vaccinated, and a guy in his around about 45 also been vaccinated. They both came back positive, but they are not extremely sick. So for now, it looks fine.
And yet,
if you have been vaccinated.
Everyone is talking to the point that we, as you said, it could be a very different picture in 1 week's time. And we don't know so much about this variant as it's just arrived on the scene. So the questions that people seem to be pointing to are just how transmissible is this if you're indicating it's already in people who've had vaccination, and potentially. And secondly, will it be able to evade immunity from either vaccination or from previous infection? So how will people, scientists like yourself, how will we go about identifying, answering those key questions?
Very important. So here you need the clinical information from the patient. I just saw a young man, that's why I was late in this, 27 years old. He thought he had a tick bite and said to me, his symptoms feel very much the same than when he had COVID in July, also confirmed COVID. But his only symptom at this stage, except for the tiredness and the headache and a bit of a very burning, eyes, sore eyes. That's more, irritated eyes. So just tested him and he's positive. So this is the first patient that I'm now seeing that had COVID 6 months ago and testing positive. So that is a reinfection. So whether that's going to go forward, I don't know. The rest of the people that I've seen this morning was all non-vaccinated young people, mostly children, that tested positive. And that is how we normally see it in the beginning of a wave. Young people, it's predominantly the children that gets positive results and then spreading it further. So I'm extremely happy for these people that I have seen that's been vaccinated. The elderly, like I've just mentioned, that lady. And there was another lady as well, 61, also vaccinated, very mild symptoms. I saw her last week. She was supposed to follow up today, and she said, listen, I'm not even going to come in, I'm fine. And that is the same that we have seen. So only time will tell us within the next week or two what is going to happen going forward. But the symptoms are not the same than with Delta. That is an important message that we need to get out so that there's an awareness and the people out there. If you're not feeling okay for the past day or two, go to your doctor, especially if it's something like upper respiratory tract related symptoms. Mm-hmm. Go and get yourself tested. Make sure you're vaccinated if you're not. Wear your masks and let us see whether we can keep this virus symptoms mild and not severe. And not severe.
So take precautions. Go back to those public health measures that the world has been following for nearly 2 years now. But what we've seen in the global response, Dr. Coetzee, has been a clamping down at the borders and at airports, travel restrictions widely brought in. Japan today, Israel, the U.S. is about to announce restrictions today. I believe we had a clip from you from the weekend saying it's hype and it doesn't make any sense. How would you assess the global response to what you are seeing clinically?
Well, at this stage, this is a total overreaction. As I said, the whole clinical picture might change. And people will say, yes, but isn't it our right to protect our people in our countries? Yes, it's your right to protect people in your countries. But then I would also caution you and say, no one will sleep safely at night, not before Africa has been vaccinated. So if Africa has not been vaccinated, because this is where your variants are going to start and your mutations. So you want to sleep safely at night, get Africa vaccinated. If we can start there, I think we will already be halfway through all the things. To close your borders, I can promise you with this mild type of symptoms that we have seen, you will. I'm quite sure this variant is already in most of these countries that's now trying to lock out South Africa.
Dr. Coetzee, you have another interview. I have to let you go, unfortunately, because I very much enjoyed our time. A very powerful argument for global vaccine equity, which is certainly a message that we're talking about this morning as well. Thank you very much for sharing your experience, and we'll be in touch and following this as one of the countries now dealing with this variant. We appreciate it.
Thank you so much, and please keep safe.
Yes. Dr. Angelique Coetzee from Pretoria this morning.